Here's a new warning out this week from the FDA that 5 drugs used to treat advanced prostate cancer can raise a patient's risk of diabetes, heart disease, and even stroke. So are these drugs still safe for you to take?
Well, Dr. David Samadi from our Medical A team is here to answer this big story this week, Doc. Make sense of this for us.
Yes, so this kind of medication is being used for high-risk prostate cancers, and it works by reducing the level of testosterone. Mostly patients who are getting radiations, or if the cancer is spread to the bone, this kind of medication is being used. FDA finally came out and said there's a new warning because of the higher risk of diabetes, heart disease, stroke, and even sudden death. So if you're on this medication and you've been using it for a long time, you don't need to stop. You need to talk to your physicians and make sure that it's safe. We always knew about the side effect of these medications: hot flashes, depression, weight gain, or a concept of male menopause, which is very interesting because it lowers the testosterone level. Now we're getting into a whole new era of metabolic syndrome, diabetes, heart disease, etc. So physicians need to watch their patient's level, the sugar level, the cardiac enzymes, and also liver.
So those are the key areas. If any of those things stand out to them, they need to not prescribe this? I mean, it seems to me that you were saying that they're over-prescribing it?
Absolutely. So as a patient, if you have a history of diabetes or heart attack, tell your physicians. And for physicians, they need to tell the patients about the side effects so we don't just overuse this kind of medications.
Right,
very important topic.
This next topic is fascinating. There's a new study that shows that new moms' brains actually expand. Now, doctor, this flies in the face of everything that I and all of my friends who are mothers think, which is that our IQs have dropped precipitously since having children.
And I'm not going to shake my head one way or the other.
So which one is it?
You're not losing your mind after having a child. And actually, based on this study, what they did was they looked at the MRI of postpartum moms. They looked at 19 mothers, and they saw at 1 month and 4 months after that there's some growth in the gray matter of the brain. In adults, gray matter doesn't grow unless there's a crisis or brain injury. So why is this happening? And the thesis or the hypothesis is that perhaps those hormones like oxytocin, prolactin, and estrogen during pregnancy actually expands the brain in anticipation and preparation for taking care of these children. What part of the brain? Mostly reward, judgment, sensory part, every characteristic that is necessary to take care of your children.
So that explains the Duggar family. She must be a genius. She's got 20 kids on the way.
That kind of multitasking.
What's even more important is what happens in postpartum, which is the question that I had after I read it, and it seems that that part of the brain is not growing as much. So I think it's a fascinating, very interesting topic.
Another fascinating topic this week for those of us who aren't getting enough exercise. A new study saying that people who actually sit too long can change their body chemistry in a terrible way, in a negative way. Tell us about this study.
Clayton, we always knew about sitting causing the DVTs or blood clots in the legs. In fact, when you get in the plane and you're 6 hours flight, you can barely put your shoes on, right?
Right.
Now we're getting into the whole diabetes and heart attack as a result of sitting for more than 6 hours. And based on this study, which is observational and we need further study, that if you're sitting for more than 6 hours a day, you have 18% increase of heart attack compared to the guys or men and women that are sitting less than 3 hours. What is the take-home message? You want to stand up, and we'll continue the rest of the conversation standing.
But how long do we have to stand for?
Well, make sure you're not sitting for a long, prolonged period. What they found was that the enzymes that cut down the fat, the lipoprotein lipase, shuts down when you sit for a long time. So what is the take-home message? If you have a desk job, if you drive for a long time, take a break. Get up and walk around and make sure you interact with other people, and that's really the healthy part.
So meaning every couple of hours, get up and do a lap.
That's the message.
And then take a break, because you've worn yourself
well,
out.
I will.
Dr. Samadi, always great to see you. Thanks so much.
Thank you. Pleasure.
Allison,
Let's do the rest of the show standing.